Is it a myth that it takes months to recover from a facelift? Hi, I'm Dr. Ramsey Choucair, a board-certified plastic surgeon in Dallas, Texas, coming to you with another educational video. There is a myth that it takes many months or weeks to recover from a facelift, and that's not necessarily true at all. And again, we have to separate whether it's upper eyes or lower eyes, but I consider those separate procedures than a facelift. A facelift typically improves the face from your cheekbone to your neck, and we call it a lower face and neck lift. Patients who fly in from out of town leave a week later. They typically will be minimally noticeable. There's usually very little bruising, and there is some swelling, but it's not noticeable to other people. It's noticeable to the feeling of the patient. As far as the basics for recovery, it's 2 weeks, we tell patients, before they significantly raise their heart rate and blood pressure with exercise. It's a month to 5 weeks before they do yoga with their head below their heart because it's too much pressure. As far as running, it's usually about a month before you run after a lower face and neck lift. Toning weights, 2 or 3 pound triceps, biceps, I tell patients they can do those 2 days later as long as they're not straining. We want you up walking around. You can go for a long walk almost immediately after the surgery. It's just watching your heart rate and blood pressure and trying not to really elevate it for 2 weeks, and then being cautious and gradual in your exercise pattern after that. If you have a hardcore trainer and you're really working hard, that's usually 5 or 6 weeks. And so there's many different facets to recovery. So I hope that puts a little bit of it in perspective for you.